All right, we have a quorum. Thank you, Doctor. With that, I'd like to call the November 8th Community Mental Health Program and Budget meeting to order. Start out by giving our mission statement. Macomb County Community Mental Health, guided by the values, strengths, and informed choices of the people we serve, provides quality services which promote recovery, community participation, self-sufficiency, and independence. Need a motion to adopt the agenda. Motion by Lou, support by Brian. All in favor signify by saying aye. Aye. All opposed? Motion passes. Next up is hearing of the public. Anybody from the public wishing to address this body, you have 5 minutes. Give us your name and address. We can listen and we'll respond to you after the meeting.
Okay. Hi, my name is Sandra O'Day. My address is 50314 Vinecrest. And that's in Chesterfield, Michigan, 48047. I'm a former employee of CMH, and I came here in June and asked what was going on with the UBHC as they were coming in and just tearing apart the program. You said you'd get back to me. I've never heard back from you. Well, I found out some information that would be, sufficient for you guys to hear. In a meeting of August 23rd, I take the meeting minutes. I tape them. I have our service director admitting that you guys didn't know what they were doing with the UBHC. That is on my computer. If you guys would like to pull that up for the August 23rd meeting, that's on my computer at work. You guys can look at that. And I really like to find out exactly why they tore up a program that was doing very good. And as far as like the UBHC was brought to divert hospitalizations, we were doing that. And I believe that they have skewed statistics for you, because you can look in the account clerk's information that does the discharges, and you can see the changes that the UBHC was doing for hospitalizations. And that's all I have to say. Thank you very much.
Thank you. Anybody else from the public wishing to address this body? All right, seeing none, we will close the hearing of the public. Next is item 4A, request to approve updated Macomb County Community Mental Health MCO policy 2-001, person-centered planning policy. Should I kick it over to you first, John, or?
No. I'll just
All right.
refer to Kimberly. Thank you.
Hi,
Perfect.
everybody. So the first policy that you see is the update to the person-centered planning policy, which is the state-required update to include information about the home and community-based services waiver, and also to include information about conflict-free case management. It was initiated in June by the department, and so this is the formal update to include in our policy. And if there's any questions regarding that specific information, I'd be happy to answer them.
Nick?
Kim, we've been doing person-centered planning for a long time. Is there any change in this that's substantive, or are we just recodifying what we've always been doing?
There's a little bit of a change with the home and community-based services waiver. There's in particular 6 rights and responsibilities that are afforded the consumer. And so those will be implemented next year, and we're going through the process of implementing those with our providers. And so that is actually included in this document.
So those weren't part of person-centered planning before, or we're just outlining them more clearly?
They could have been part of it before, but now according to federal law, these are requirements.
Have to be.
Right.
Okay.
For example, they can lock their bedroom door if they'd like to. Things like that to give them more individual choice.
Gotcha. Thank you.
Yeah.
Kathy?
Thank you. And so again, these are policies that have changed at federal and or department level that
Correct.
we don't have a choice of accepting or not if we're going to be part of, if we're going to receive the funding and be part of the
Correct.
The state plan, we have to adopt these.
Yes.
All right. So
yeah, and our providers are, they've been going through the process of becoming compliant with the waiver requirements.
just curious, how long do organizations have to comply?
Until
Like
next,
us, for the vendors, the service providers, how long do they have?
I believe it's until next year. However, any newly panel providers will have to, especially residential, will have to meet the requirement immediately.
Okay, thank
So.
you.
Any other questions? All right, seeing none, I need a motion to forward to full board. Motion by Lou, support by Kathy. All in favor signify by saying aye. All opposed? All right, forward that to full board. Next is 4B, updated Macomb Community Mental Health MCO Policy 4-010, provision and distribution of information to consumers.
So this is also to comply with federal requirements. The Medicaid Managed Care final rule was initiated last year, and with the initiation of that rule, they implemented specific provisions that would need to be implemented each contracting year for the next several years. So because our contracting year started October 1st, these are being implemented with that contracting year. So for the provision and distribution of information, a couple of the key provisions is there's more information in the enrollee handbook. There's more information in the provider directory that's available online, and the consumers can also obtain a written copy if they'd like that. One example of something new is that we will try to give the consumers notice within 15 days of the termination of a network provider. So things like that. To give more, it's basically to give more information to the consumers so that they can have more information in order to make a choice, an informed choice.
All right, do we have any questions?
Yeah, did you get my signal? I'm playing by your rules.
I don't have yours.
Well, it just disappeared. I guess you had a time-limited button.
I guess. Lou, go ahead.
It occurs to me that all of these are updated boilerplate, frankly, and they're just nothing but that, bringing us into the current time and adjusting to various programs. So if you have no objection, I would make a motion to approve 4B through G and do it as easily as possible. If there's no objection, that might be prudent.
Thank you.
I don't care if you do it as a motion, but I still have some questions.
Yeah, we have a motion on the floor. We can, if there's support, we can have questions after that.
Support.
Support from Brian. Nick, go ahead.
Okay, on this one with the notices, and maybe I'm just reading it wrong. Maybe I'm just reading it wrong, but one of the problems you always have is the assumption everybody uses computers, which is we're
Correct.
getting too quickly. So for instance, when you're providing under the enrollee handbook, it says you're going to provide it by email if the employee agrees. I understand that. But then for posts of information, it says it's going to be on the internet. Well, if somebody doesn't have access to the internet, I mean,
Right. Well, that's actually new. Before, we never included it on the internet as a requirement, and now that's an added requirement.
I see,
Yeah, so it's just becoming compliant with the new technical requirements.
I see. And the provider direct the paper requirements. The other thing that kind of worried me a little bit was there's a provision that says you're going to update these at least monthly, and then
The provider network.
the provider network, okay. What if there's no change in the month?
Well, then there wouldn't be an update.
Okay,
And generally, our panel doesn't change. So it, I mean, we might need to add a little bit of information, but it wouldn't be a substantial amount of information.
okay. I'm particularly concerned about the provisions dealing with, on the next piece, dealing with the appeals process. A lot of that is controlled by the mental health code.
So for the Medicaid,
The Medicaid appeals process.
the adverse benefit determination, or the grievances?
The grievances.
Okay, so the non-Medicaid grievances hasn't been changed. All that's been updated in this policy is the Medicaid grievances. the process for that.
And updated,
Updated to comply with the Medicaid managed care final rule.
that's the federal rule.
That's correct. So for example, now there's a 90-day time frame for resolution, and the individual involved in the decision-making wasn't involved in a previous level of decision-making, so that they're independent. They've expanded the definition of grievance to include any expression of dissatisfaction other than an adverse benefit determination. So it gives them actually more rights to be able to grieve an issue. So what you'll see is our grievances will increase because the definition has broadened, but it's consistent with Medicare Advantage organization's definition. And so what they're trying to do is make it consistent with that and the marketplace rules, because they believe this population will move in and out of not only the PHP, but in and out of maybe a Medicare Advantage organization and the marketplace. And so in order for them to more easily navigate, they wanted to standardize the process.
Gotcha. And that explains the changes in E as well, the local appeal process for Medicaid?
The local
E.
E.
Those are the two that deal with appeals. Well, C, D, and E. all
Right,
deal with
yeah.
appeal.
It's the same thing. It's to update
Just make it
to
all
the
consistent.
standard, yeah, the federal standards. So, and it gives the beneficiary more of an opportunity to pursue their appeal or their grievance. In the appeal section now, they have the right upon appeal to request their case file. So all of the documentation that was used to make the denial decision, they can obtain that just by requesting it when they request their appeal. Also, there's a definition in here about the hearing officer's qualifications, and one of the qualifications is that they can't be involved in any previous level of decision making, so that they're independent, but they also have to be able to have the clinical decision making experience in treating the enrollee's condition. And so basically what that means is that it'll be peer-to-peer, like what we do with My Health Link. So if there's a denial made on an inpatient level by a physician, you would have the same level of reviewer at the PHP level.
Thank you.
You're welcome.
All right, board members, if anybody has a question, raise your hand. I'm having technical difficulties over here. Lou's not the first. Is there any other?
You've got to go to the
I
agenda
did.
item.
I did.
No, but he may not have.
Oh.
Because I did the same thing. If you don't go to the agenda item,
Okay.
it doesn't turn off the old one.
Any other questions on items B through G? All right, seeing none, we have a motion and support to move to full board. All in favor signify by saying aye. Aye. All opposed? All right, those are forwarded on.
Thank you.
Thank you. Next is 4H, the elimination of term limits for the Citizens Advisory Council members.
If I can just do an introduction of this one, Lori Valuet and Linda Bush, I believe, are going to help us have some discussion relative to change in the bylaws. Lori, if you want to come up to the podium as well, you can. And at the request of the Citizens Advisory Committee to reconsider some of the bylaws when it speaks to the length of the term that members may serve on the Citizens Advisory Committee. And for those who you may or may not know, Mr. Don Nagy is in the audience. Don is right there front and center. And Lori, put your hand up, Don. And Don is and has been the chair of the CAC for some time. And so we certainly appreciate his efforts and his interest and very sustained involvement in helping shape and guide community mental health services. So with that, I'll let Lori and Linda kind of tag team back and forth together and give us an introduction of the request that's before the board here. Thank you.
Okay, basically what has happened is the council is asking for the board's consent to eliminate the term limits that exist for Citizens Advisory Council members. When the Community Mental Health Board established the Citizens Advisory Council in 1994, it established that the members would have 2 3-year terms and a partial term, and not more than such. However, we've found over time that it takes a considerable amount of time for Citizens Advisory Council members to learn the skills that they need to become really efficient, effective members, and essentially we'd like to keep them longer. And because the board's original proposal stipulates to these term limits, we need basically the board's consent to eliminate those limits in order to keep certain folks longer or to be able to have that opportunity.
Linda?
I serve as the liaison to the Citizens Advisory Council, and Lori, to the John and Lori's credit, they have done a great recruiting effort of late, maintained some of the longer standing members who are so beneficial, and really kind of gotten some new blood too, and with Don's leadership, and I appreciate you being here tonight, Don. He has to chair the meeting tomorrow morning. The meeting is the second Thursday of the month, and it's very interesting. I welcome any of you to come to it. I think Don would allow them to sit in the audience. And because John and staff give such great presentations to the CAC. And since I've been on it, the issues that we've been dealing with and that Michigan Association of Community Mental, they have a new name, Community Mental Health Association, the advocates from CAC, anytime John or anyone asked them to help with testimony before the legislature on any of those issues, they were informed and ready to go. So what I see as one of the issues that Don was and Lori were trying to address with this is that it's so difficult to get people to serve on this because of their personal lives, what they're dealing with in their personal lives. And to be able to come to a monthly meeting sometimes is hard to do. So their time is very valuable, and we appreciate having them. And a 2-year turnover, is it
It's 3.
3-year term turnover doesn't really facilitate that learning process and the advocacy that they do. Don, did you want to say anything?
No, I just think, the membership that we've had, I know several of us been a lot longer than the 6-year term. We volunteer our time and effort, and I think there's a lot of skills, a lot of knowledge, and we come and contribute because we really feel that Macomb County offers us a lot of services. Our families are users of client services. We are giving back to the community, and we have a lot of skills and knowledge we'd like to continue with. And we do it on a volunteer basis, and I think losing some of that skill set would be not advantageous to the community that we service. So we look forward to being here. We're part of the community. I'll be honest with you, I've been here for almost 12 years. I contributed 6 extra years of time. I want to continue to do so because I think it helps the community and the people we service. It's not for individual benefit, it's for the community service that we treat. So we listen to a lot of people, have a lot of input. We bring it back to the CAC, we discuss it, present it to John and to Linda to bring it back to you people. So hopefully you'll see the seriousness of our efforts, realize we want to contribute back, but we need to have some blessings to continue on beyond the 6-year term limits that are designated in the 1995 document. So we hope that you'd consider it. We'd like to be part of this and look forward to your decision.
And in terms of giving us information, Don has had conversations with Lori and John and myself about reporting quarterly, and they're waiting till they get some of the new members oriented and everything, and then he'll get a date with John to come and do that. And whatever your pleasure is, if you want to, a report every month or whatever, I can do that, and then Don come quarterly, but at the end of the meeting or something like that.
Thank you, Linda. All right, I think I found my list of questions, but we'll see if it's right. Nick, are you on there? Lou, are you on there? Well, I found you guys. Susan, go ahead.
I find that encouraging.
We're making progress. Go ahead, Susan.
Thank you, Mr. Chair. So I am in favor of this item, so let me just start by saying that because I'm not a big fan of term limits in general. I think when we have people that are willing to give of their time to such a worthy cause and we value your input, I would commend you and think that we should be removing the term limits. But I do have a couple questions just to make sure that we're not removing opportunity for other people. Mm-hmm. So if I'm remembering correctly, we appoint these positions. I think I recall voting on these items, and I just want to confirm that.
That's right.
Yes. So, are there people waiting to serve and hold these seats? Or Linda mentioned that it's hard to find and recruit people sometimes. So, I just want to make sure we're not denying a fresh perspective.
There are no people waiting, and we do have open spaces. Yes. And we keep an effort, John and I and others keep an effort to keep spaces open in case there's a special need for some special skill, or in case, you know, someone comes along that we really want to add. So the proposal allows for 17, up to 17 members. At this moment, we have 11.
Okay, so
there's
we
plenty
have
of
space
room for
good.
you know,
Because I
new
like
folks.
to just make sure that when we have someone that comes forward that wants to serve in that capacity, that we have a spot for them, for their voice to be heard. And I would even encourage, with the new, you know, with some of these changes, and as you're expanding and recruiting for this board, even once you fill seats, you know, other boards that I've served on maybe have ad hoc committees that maybe don't have voting capacity but could work on specific issues. That might be a good way to give voice to other people. So I want to thank you both for your time and commitment to this effort. Really appreciate it. Thank you.
Thanks, Susan. Kathy, you were on, now you're off. Are you good? Do you want to speak? Perfect. Okay. I guess my question to you is, so let's say you find 17 people, you fill everything up, and then there's an 18th or a 19th person that wants to come on. How would you handle that situation if we get rid of the limits?
I might come back to you and ask you to add another person.
Good answer. Thank you.
Okay, thank you.
That would be a great problem to have.
That would be a great problem. That would make me really happy.
Absolutely.
Okay.
Any other commissioners have any questions? All right, seeing none, take a motion to forward to full board. Motion from Nick, support from Susan. All in favor signify by saying aye. Aye. All opposed? All right. Next up is the lease agreement for residential facility A. John?
I guess sticking with the format and the way we're doing things lately, it works for me. I'm going to invite Tracy and TJ up to run through these, I believe, 2 leases that we have. So I'll turn it over to both of them. Thanks.
In front of you, we've followed the direction that we had previously spoken about. You should see them properly labeled as lease A, and that includes the city and major factors related to that particular home. The first one that you're looking at, lease A, is, if you notice, a increase of 0.01%. It's a very small percentage, and it's due to taxes, not insurance, on this particular lease. And TJ and I have both reviewed all the information and are recommending approval of this particular home. Of course, we'll take any questions you might have.
Does anybody have any questions on A? I still don't see you guys. All right, we'll go Brian and we'll go Lou.
I'm just wondering why it's marked off the addresses and all that in here, why there's black marks on it.
Sure. Last time when we brought it before, there was a debate because all of this information goes on the public Macomb County website. So we decided, in an effort to be more restrictive, to mark through any street addresses of the homes or lot numbers or anything that would identify the home, and left the cities and state after bringing it before this board last time and getting their opinion on that. And if I've misspoken of that. Yes, of course, it still falls under FOIA material, so anybody could still access that information and any board member could get it, but we were just trying to be less out there to literally provide the address of the homes where our consumers are located.
Trying to give them a little discretion.
Yeah.
Yeah, I believe this is something we voted on last month or a couple meetings ago.
Spoke about it.
We did discuss it, and we decided that that was going to be the path going forward. If we want to change it, we can, but that's where we, yeah. I'm just clarifying it a little bit. You might have been. Lou?
Actually, I had 2 questions. That was the first, the redaction. I'm not so sure I'm comfortable with that, frankly. And I don't specifically recall the situation where we voted to do that on leases. I think it's no secret where they are. you know, we've come a long way since the 70s in relation to group homes. And frankly, it's been an improvement, but where they are is public knowledge, frankly. And I think redacting it, in a sense, creates an issue where there shouldn't be an issue. In the sense the public may say, why are you withholding the location of group homes from us? And I don't think that's what we want to do. I think perhaps whatever the situation is, my suggestion would be that we ought to visit that or revisit that, because I think that's not good public policy in the sense of wanting to be open and clear with whatever we do. I think we're sending a bad signal there. My second question was, it's a licensed foster care facility. Foster care facilities are a process that can lead to adoptions, if I'm correct or subject to correction. We have consumers with DD situations or mental ill situations that are in foster care facilities that are eligible for adoption?
No, in the lease, the actual state of Michigan calls them the
Well,
adult
I'm
foster
looking
care.
at page 1, and it says it's a licensed foster care facility, which suggested to me, it doesn't say that. It says licensed foster care facility is what it says on the documentation, and in the sense of having redacted the address, that led me to the question that in the public perception, that is not something we would want to do. If you look at page 1 over 158, it says, the tenant is willing to lease the premises for use as a licensed foster care facility.
That is the terminology that we have had in this lease historically. If you notice on the same page, not to debate that that's not relevant.
I can't really hear what you're saying.
Sorry. That's the terminology that this particular lease template has had for an extended period of time. I think it's a valid point. Also on page 158, near the bottom of 4, it talks about the landlord further warrants the premise shall meet the standards of the state of Michigan approval for adult foster care facility defined as, and then it defines what we mean by this particular home and what it is made of, if that.
Okay, but up at the top, it just said licensed foster care facility. So I'll go back to my original situation. Personally, I think redacting addresses is a poor public policy, and the board ought to consider revisiting that, because in the sense of our business is wide open, we don't want the public to feel that we're withholding any information from them. And I think it's something we ought to really consider.
If I'm not mistaken, Lou, the last time that a lease came up, this exact discussion came up, and it was my understanding that we would move forward with the redaction and see how that played out. There was no vote on it, but we would see if there was any further discussion, exactly like you're bringing up. So if that's the case, we could bring it back for discussion. We were simply trying to offer the residents of these homes a bit more discretion on where they lived. That was the sole reason.
Then I would suggest that it would be Vosberg and Kinch who might want to consider whether or not that comes back. I'm suggesting that I'm not comfortable with it, and I think it's poor public policy that would raise negative questions as to what we're about. I think it affects our image. So anything I say would just be repetitive. I think we really ought to think about that.
Thanks, Lou. I just talked to John about that, so we'll take a look at it. We'll revisit it. Susan, you on my list? Yeah.
Thank you, Mr. Chair. So I do recall the discussion that we had last month, and I was under the impression and expected them to be redacted this month. I will say probably need to darken them out a little bit more because I can still see it.
Sure.
It just has to do with the way the scanning works, so it's new process. So we probably need to use whiteout or something like that rather than black ink. But I I do think that we should be redacting them. I think that you're right, the information is FOIA-able, and if people want to know where the home is, then they can submit a FOIA and get it, and we would certainly never deny that. I think that with the information being on the internet, it makes it a little bit different than maybe how it used to be. And so I value the privacy and the concern, especially with some of the, whole not in my backyard mentality and the way society is today with anybody being targeted. I just feel like it's a better policy to have it redacted. And that way, if somebody wants to know, then there's a record of them FOIAing it, and we know who's FOIAing which addresses and whatnot, and it might even help if, God forbid, there were some incident. So I'm all about the traceability. My question is, and I apologize, Mr. Chair, are we just on the first lease, or can I ask a question about the second lease?
We're just
or
on
should
the
I ask-
first one right now, but
Okay.
yeah, we'll get to that in a second.
Okay, so I do have a question, so
Okay.
add me to the list. Thank you.
Does anybody have any other questions on the first lease agreement for residential facility A? All right, seeing none, I'll take a motion to forward that to full board. Motion from Susan. Support from Brian. All in favor signify by saying aye. All opposed? All right. Next is lease agreement residential facility B. Go ahead.
So the same overview, if residential facility B is an increase of 1% overall, and the increase is due to a slight increase in taxes and a slight increase in insurance. From my recollection, I believe it ends up being $32 a month, so it's a very small amount. And the rent of the actual base rent stayed the same.
Susan?
Thank you, Mr. Chair. There's a handwritten note here that said that the deck was going to be completed, yesterday or the day before? I don't even know what day of the week it is.
It is not completed.
It's not.
It is not completed. I spoke with the home today, and we had every impression that it would be completed by now. This is a build over a current cement structure that's crumbling. And
Have they started it?
the lumber is on site. It's been very, very difficult to find contractors lately, as you may or may not know. There is a contractor lined up. He's already had a deposit check. This deck will be built. I'm confident of that. But it was not done by the date that the landlord said it would be done. He has struggled with that contractor. So I do believe it will be completed. Everything is on site to make that happen.
So do we, I'm not your recommendation, I'm not opposed to approving this, provided that you feel like you have some mechanism that should it not get built or built to your standards, that you would have some recourse. Do you have any recourse if it's not done or done to your satisfaction?
Technically, no.
What would happen if we postponed this a month?
We would probably bring it before you next month with a completed deck.
Is that a better, are we putting anything in jeopardy by postponing it a month?
There's no change in the dollar amount other than the small increase that Tracy just spoke about, so I can't foresee that, but at the same time, I can't speak for the landlord, so I couldn't really tell you that.
So if we postponed it a month, it just continues on its month to month?
That's correct.
I don't remember. When was this expired already?
It
Yes,
did.
that's the only downfall. Not that that's a negative thing, because we do have a contingency of month to month in there, but it is already outdated. So it's your preference.
Okay, yeah,
I can say this about the rest of the home. It is one of the nicest homes that we have. It's
Okay.
very well cared for. There is a good relationship with this provider and the
and they've been
management, so
responsive to
very
repairs.
responsive.
We have reason to believe
Yes.
we have every reason to believe that this will be done and done correctly, right?
I do.
Okay, because I just get worried about some of that sometimes when, they say they're going to do something and then, okay. All right, on your recommendation, I'll go ahead and vote in favor. Thank you.
Nick?
Yeah, TJ, obviously, we're not finally approving this today. It's got to go to full board. Do you have any reason to believe we'll see some advancement by the full board meeting?
What is the date of the full board?
2 weeks from
I
yesterday.
suspect that it will be completed by then, and
Okay.
that's a great idea. I didn't even think about that, but yes.
Yeah, I don't have because it's a safety concern. It's the only thing that disturbs me about it. I don't have any problem with moving it to the full board, but I'd ask that you report to us at full board
Certainly.
as to whether it's been done, or at least,
Certainly.
as a homeowner who has just had some repairs done on my house that didn't get done when the contractor committed to do it either. I sympathize. I don't think there's a problem here, but I just think we have to keep an eye on it, obviously.
Good idea.
All right, thank you both. With that, I'll take a motion to move lease agreement residential facility B to full board.
Support.
Motion by Susan, support by Linda. All in favor signify by saying aye.
Aye.
All opposed? All right. We'll see you in 2 weeks. Next is a receive and file Macomb County Community Mental Health Medicaid Billing Verification Audit Summary, fiscal year 2017. John?
Thank you. You know, I'm going to run through this Medicaid audit for you really quickly. About 15 years ago, the department, when we became a PIHP, indicated that you have to perform a Medicaid and a non-Medicaid billing audit to track your dollars to make sure that the services were actually delivered. The board has, subsequently over the last same number of years, contracted this activity out versus doing it in-house. And I might say that your efforts to contract it out in the manner that which we do with now an agency called Express is considered the best practice in the state of Michigan on how we're doing it. So we throw a little bit of money at it, and we really come up with the best practice. So back in June, the board approved the amount for the Medicaid and non-Medicaid billing audit to continue. And if you look at page 1, the scope of services is among the quality standards is the requirement for the PIHP to develop a methodology for verifying that Medicaid services claimed by providers are actually delivered, specifically under contract with MDHHS. And where we look at particularly, we look at about 15, 17 different documents in the progress note, but what is an absolute must is 1, whether the services claimed were listed in Chapter 3 of the Medicaid Bulletin, and number 2, whether services were identified in the person-centered plan, and number 3, verification of documentation that services claimed were actually provided. So this is actually a 2-year look back where we're here in 2017, and obviously we're looking at claims and progress notes in 2015. One of the interesting sidebar pieces of this contract is it's become a lot cheaper over the course of time. It used to be about $280,000 to do it. Now with electronic record, they don't have to go on site, and to all the sites they can just review our electronic records and accomplish the same task. So the summary of findings is really on page 3. It indicates there that there's a random sample where they pulled 3,567 claims, representing just 0.1% of the population of all the claims. 2.2% of the dollar value. There were 34 vendors that were audited, including Macomb Oakland Regional Center. The audit was conducted June, July, and August. September, I believe, they wrapped it up. If you turn to page 4, it really gives you a breakdown of what we were looking at. So on page 4, the population really was 555,000 claim lines when you look on electronic record and how claims are submitted. So we're looked at 500,000 claim lines, which represented $172 million worth of our business. The number of claims that they actually audit, they go through a stratification process to make sure they have materiality in their audit. So they actually looked at 3,567 claims, which represented $3.8 million, and which is a good sign that our providers are doing what we've instructed them to do as a PHP. I'm on page 4 here. In error number 1, which was are the services in Chapter 3 of the Medicaid manual, there were no errors at all. So everybody, all those services that we authorized and the services that were delivered and that we paid for were part of the Medicaid manual. Error number 2 is or whether services were identified in the person-centered plan. So if there was an omission and it wasn't identified in the plan, then we shouldn't have been paying for it. There was one error where we couldn't identify that, and the cost of that was $85. We're going to recover that $85. And then error number 3, where the supporting documentation was missing, that the service was actually provided. And mind you, it doesn't matter if a tornado come through, if there was a flood. We've had all kinds of other instances. If the claim is not available, then we will recover those dollars, regardless of what the circumstances behind that. Doesn't matter if a group home moved from site A to site B and they lost the files. We're going to recover those dollars. So in error number 3, where the documentation was missing, there was 13 instances where the claims were actually or the documentation was missing. And so that will equate to $3,140 in recovery. So the error sample is the total number of dollars, or total number of errors, is 0.1 or 0.4%, which is incredibly low and exactly where you want to be as a board and as an administration to ensure that your Medicaid dollars are being delivered where they're supposed to be delivered. If you turn to page, there's more detail in here, but I'm not going to run through it all. If you turn to page, it's not numbered, but it's a similar graph for the Office of Substance Abuse from ACOSA. And if you peel through your pages, and I apologize, I don't know why it's not numbered, but you're going to see the same graph where they looked at the population of 382,000 claim lines. The number of claims that they audited were 17,000 claims. The total number of exceptions was 487 exceptions, and the recovery amount is $17,000 plus some change. So again, that's pretty low. That's less than 5%. If you get over 5%, I think you're going to have the healthcare industry looking at you and what you're doing relative to the Medicaid auditing. So the error sample there was 2.8%, where they didn't have documentation to support the claims. And the recovery amount, I already told you the recovery amount is about $17,200. So we'll go about receiving those dollars back from the department. There's a number of other items that we look at trying to manage the Medicaid manual or the record, but we don't necessarily recover dollars, but we do provide technical assistance and guidance when we come across omissions in the record. So overall, every year I think the report continues to be better and better and better. I think when we initially did this, it was around 12% errors, and that's when the PHP was just starting, managed care was starting up. And so over the course of time, we've really been able to make sure that our dollars are being spent according to the Medicaid manual, and the providers are actually delivering the services for the claims they submit to us. So it's a document that was sent, signed off by Mr. Losey, and sent up on October 31st to the department for their receive and file in compliance with the contract.
Thank you, John. Does anybody have questions? I don't see anybody. Nick?
John, can you go over the graph on page 210?
210?
Chart, I should say. I'm not sure I understand what that is, but
Nick, is that the one that has the block grant, Medicaid,
Yeah,
Healthy
yes.
Michigan? Okay.
yeah, by funding source, because there are dollar exceptions that are fairly large in certain categories, and that may just be because the sample size was so small.
10 or 2?
Is that us or them, or is that a comparison of how we're doing compared to, say, Molina, which
You're gonna
is
have to-
41%?
You're gonna have to give me a minute, so I can't. Okay. I'm working from my paper copy that has all my notes on it, so I apologize. Gotcha. Okay. I got it now, yep. So the question, once again, I'm sorry.
I'm not sure what that typifies. I mean, why, for instance, is Molina, My Health, Medicare, Molina at 41%, percent? Is that because the sample size was small, or are we comparing our 0.1% error to Molina's 41%? I mean, I'm not sure I follow what this chart is signifying.
Well, it's certainly the early beginning evolution of My Health Link demonstration. Because if it's Medicare, that overlaps with the Medicaid, Medicare, the dual eligible demonstration project that we have going on. And so if the sample size was small at 6, I mean, obvious, then the exception is 3. That certainly, due to the low N, is going to drive up that percentage. The total number of dollars recovered is $196. So they probably delivered 3 units of services and didn't have the progress note for those 3.
Gotcha.
Some version of that, yeah.
Gotcha. Okay, I understand. Thank you.
Yep.
Susan?
Thank you, Mr. Chair. I didn't want to push the button because I don't want to lose my page. So, I mean, if I'm reading this right, because I mean, I understand that the sampling is very small, but I mean, I'm looking at like Medicaid Healthy Michigan, where we had probably, it seems like a high sampling, over 7,000 records, right? And they found 198 errors, which is only a 2.8 error ratio, which is fairly low. But when you apply that to how much money we have, I think that's saying that the 7,000 claims that were sampled represents $212,000 or $213,000, and that if you applied that same 2.8, or if you applied that, took those 198 cases, they're worth $9,300, which is a 4.4% dollar error, I guess, is what we're saying. One's a case number error and one's a dollar error. So, you know, while, you know, that number seems relatively small because Medicaid Healthy Michigan is such a big budget, the 16th Circuit Drug Court, which they sampled 1 and found 2 exceptions, which makes, that doesn't make any sense. How could you have more exceptions than what you sampled, right? Because they're saying that's a 200% error and it's resulting in $196. I'm a little confused by this chart. Yeah. And then some of the notes below it kind of are more about documentation, missing files, missing signatures, things like that. And is that, I mean, do we have to do some remediation, some record keeping there? I mean, because isn't that some of that stuff pretty critical or not?
Well, if the
right, but anything dealing with medical, right, anything, I mean, I know it's the MACOSA section, but any time you're dealing with billing of medical stuff, if you don't have the right documentation, do we have some process issues maybe that we need to address as a result of this?
Well, as I indicated, the 3 areas that we do recover for are indicated on the first page. There's also the consumer or the person maybe not had signed the document. We may not recover for signature, or they didn't put down their credentials and privileges. We may not recover for the absence of credentials and privileges. So you have those variances that are allowed. We continue to provide technical assistance on those, and those variances that are not allowed. And so I agree with you that perhaps it is a little bit misleading to have totals across the bottom of the page there, given the you know, whether the Medicaid funding is related to block grants or whether it's related to Healthy Michigan. I think it was maybe an overreach on their part to be able to provide totals that indicate what the overall performance of the block grants were. But it may be, you know, using a little bit of apple-orange methodology and running your totals.
Yeah, I mean, it just seems awkward the way they're paralleling the report. So I'm not startled by the findings, right? But anytime you have an audit, because I mean we're looking at potential 4.3% error in dollars and a 2.8% error when you look at them really across the board. It's not huge numbers. It's still a good audit outcome, but you want to improve your processes, right? And so all these exceptions listed below give you the opportunities of where you want to do improvements. Correct. So what type of follow-up are you doing on that? Are we planning to do any process revisions, any internal audits ourselves, anything like that?
The providers are always required to perform to the contract, and they always have, compliance meetings or meetings with their contract manager to be able to continue to be more proficient in the progress note and to be able to, meet the minimum requirements. So they probably get technical assistance along the way. Does the Office of Substance Abuse, in this case, go out and run through each one of the reports with the provider and let them know what the findings are? No. Does the provider receive a copy of the reports and they also do know what the findings are? Yes. Is it contractually expected of them to continue to have better performance and improvement? Yes.
But we're not putting anything in place to do that. And
Yeah.
maybe the answer to that is, no, this is within reason and we don't need to change anything. I don't know. I'm just asking the question if there's going to be anything done with this.
No, we don't put anything further in place to, have them accountable for a non-recoverable item.
Okay. Thank you.
All right, I don't have any more speakers. Is there anybody else that has a question or comment? All right, seeing none, take a motion to receive and file the summary. Motion by Kathy, support by Brian. All in favor signify by saying aye. All opposed? All right. Next is other agenda items. John, you want to start us off? If you have other agenda items?
Sure. We have time here. I can certainly give you some discussion relative to our meeting in Lansing that we had. Cynthia Mack and I went up and met with Tom Renwick from the department and John Duvendek and Michelle Jordan to once again talk about our financial risk status report and our financial risk management strategy. And in doing so, we provided them with our final FSR of 2016. We reviewed that with them and really showed everybody, if you remember back in February, we were about $9.8 million into the department's risk corridor, having burnt through all of our $15 million in ISF plus the $9.8 million we would have been really in the red for. So we showed them that. We showed them the mid-year status report, which was dated on June 5th of 2017. And at that point in time, we have recovered $9.8 million, and we had really $340,000 in the green there, favorable. We showed them the third quarter FSR, which was just done on September 6th here, and that number actually is $11.3 million. And that's what was discussed here with the board the last time that we met, that it had the $5 million that was part of the appropriation by the department, and the $6.3 million, not quite $6.3 million, I'll say 5.2, that was Healthy Michigan dollars that were being used to support the B3 state plan services. And it goes back to Mr. Birdie's concern that it was, kind of unusual economics to use Healthy Michigan dollars to support your state plan and B3 services Medicaid dollars. But it's about $5.2 million. And then we did have really about $1.3 million left over in Medicaid savings. And so really our financial risk for this year that began on October 1st is right based on our budget of $168 million combined. Our financial risk is right around $12.2 million. So we conveyed to our friends there that we had, a proxy financial risk, and we need to come up with a risk management strategy for $12.2 million. And our concern was that the board continuing to have to be in position as we are, where we've made all these cuts, and through the numerous cuts that we've presented before the community related to community living support services. So we went through that with them. We explained and they were complimentary. First, I'll say that we're able to fix our budget. I mean, from their perception, we're doing good and we're able to fix our budget. And they were complimentary of that. But we did explain to them that the hardship that we put on the community relative to the reduction of community living support services across thousands of consumers, conveyed to them that we really, I was subtle about this, really kind of have a waiting list, which is prohibited for group homes. and I've got 2.5 dozen consumers who are waiting to get into a group home because we've cut their CLS services. But I was very soft about going too far with that because it's prohibited to have a waiting list for Medicaid covered services. I talked about the 55 or so positions that we've held vacant across administration and service line workers. And so I brought them up to speed on that. I talked about the fact that our providers are also challenged with the 2015 rates still being imposed in fiscal year 2018. The fact that I cut the acute psychiatric inpatient providers, we cut them 7.5% sometime before, now we've cut them an additional 5%. That was approved by the board. The voluntary furlough days and the other items that we've done to really put ourselves in, that was once a difficult situation, to get out of that difficult situation. So they understood all that, and I also explained to them that the board is not interested in a continuance of having to cut services to consumers for CLS that we're already feel that we're, maybe marginally at risk, and we don't want anything happen to any of our consumers. To which they indicated at that point in time, you don't need to have an ISF. You don't need to have, cold hard cash. They said all you need to do is mitigate your risk, and so you just have to have a strategy to mitigate what would your risk would be on $164 million. So we pulled out the contract and we showed to them and pointed to them and highlighted on page 70 of the contract that PIHP may use one or a combination of measures to assure financial risk protection, including pledged assets, reinsurance, or creation of an ISF. Now that reads pretty literal to me, as we talked about last time, that you have to create an ISF. And they looked at that and they said no, and they kind of got frustrated. And we've already had this with me, I think, that they've had the discussion the last time we met with them, and I think in February or March. They said you don't have to have an ISF. You just have to have a risk management strategy to mitigate your risk. And so their articulation there was that if you're, following your community living supports cost, and as you trend over the course of years, you see that your costs are going up, presumably, in increments or whatever that number might be over the course of years, then what are you going to do to mitigate that? And so the implication is that, we would engage in greater utilization management efforts to, cost set or offset those risks. Or if you see that maybe your staffing costs are going up, and as your staffing costs are going up, what could you do internally as an administration to also mitigate that risk? We didn't talk in specifics, but that's the general terms and concept that they want to use, is that you don't have to have the dollars. You just have to say, over the course of, you have so many different trends that are evolving, maybe the leases for one, if your lease costs continue to go up and up and up, and then to mitigate that, then, maybe you need to do something different in your business management strategy to lower your lease costs. And so the end story is that they're not looking for $12.2 million. They said you can have an ISF of $4 million if you want it. And so it's a little bit perplexing to me that we can sit here with an ISF of $4 million, but let's just say hypothetically next year on September 30th, we overran acute psychiatric inpatient by $6 million. And that leaves us without $2 million. That leaves us into the state's risk corridor. So, I've long, since I've sat in this position, have been of the opinion, have operated so that you need the reassurance, the equity, some type of equity, and or cold hard cash as an insurance, as we were talking the last time, insurance or fund equity. They're saying you don't have to have that. You just got to put together a narrative that says, where are your rising costs, where are your sinking costs, and how are you going to be able to mitigate your risk? So with that in mind, if that were the pursuit that we were to take, and if, I wouldn't advise this board to, adopt a $4 million ISF, our swings are great. We've had $10 million swings over the last couple of years here, and that's a little bit unnerving. I think we should have and plan for a $12.2 million ISF. That being said, you have $5 million right now. I showed you the last FSR, and we'll have another FSR coming out. I think we're going to have it ready for November 21st. It's due on November 15th, I think, right? Right, Cindy? It's due?
It's due the 10th, actually, this week, but by the time we put the executive brief together, I'm not sure if they'll make it for the 21st, but for sure,
Okay.
in budget December.
All right, so Cindy said that the interim FSR is due on November 10th, which is Friday. She'll put the executive brief together that you're familiar with. She don't know if she'll have it ready by the full board on November 21, but certainly for the program and budget, which is on 12/13. So we'll give you the executive brief there. But in the executive brief of the interim ISF, you're going to see $5 million that the legislature appointed to us. You're also going to see the $6.3 million or some variant of that, of Medicaid and Healthy Michigan Plan dollars that keeps us, I'm still projecting that this is going to be accurate, of around $11.3 million. So I have to come up with a few words to say that we're going to use more crisis stabilization or urgent behavioral health care center to lower our acute inpatient costs, and that's our strategy. And then the challenge for this board, because I can write that strategy, and the way they think is, you don't have to have the money. So the challenge for this board is that they're going to sing a different story than we're going to sing. And they're, saying just mitigate your risk, and we are saying we want the money in insurance sitting in the bank. They're going to tell the legislature their side of the story, and we're going to tell the legislature our side of the story. And I personally, professionally believe that the $7.5 million get that we want is going to be more perplexing to the House and the Senate, particularly the House members, than the $5 million. So that's where I'm at, and the department is just, having, a different read on the contract than we've ever operated. And then we also talked about, I'll wrap it up here, we talked about the engagement, the TBD engagement that looked at our CLS utilization management practices. It sounds like maybe that's going to be forthcoming pretty quickly, because Cynthia and I are going to at least have another meeting with Duvendeck, or with Tom Renwick, to set that up for, I think, November 28 or thereabouts. So I believe that report coming from TBD Solutions may be viewed in the next couple of weeks. And then if we go back to the Macomb House and Senate on that, whatever how the report reads, whether it reads in favor of us, reads in favor of the department, or something in the middle. And then there was another sidebar issue that we raised and concluded the meeting with, where they felt, the department felt, we were using some type of tool to use CLS practices, and a tool would be prohibited. And I've asked for clarification now for 4 months, and still have not been provided any direction from the department that, in fact, we are not using a tool. So I remain convicted and sit here that we're not using a tool, and the department hasn't given us any clean answers on that over the last 4 months. And they apologize for that. I sent you that email that they haven't been able to give us an answer on that issue. And so that concluded the meeting, other than they wanted to meet again real quick in a month.
Thank you, John. Nick, are you on my list, or is that from last time? Okay, Brian, and then Lou.
In the meeting, John, we're pushing that it says in there that we have to have that safety net in there. So if they're saying we don't, has it been suggested they need to rewrite it, that we don't have to have that safety net? And then would that put the pressure back on to the department that's saying that we don't need that? If an issue comes back, it would go back to the department, because they're the ones that told us we don't need it.
That's a great question. We can ask them, through formally or informally, or probably formally, to have them clarify that.
I would suggest formally, because if they're saying we don't need it, then why is it written down? Take it out,
Yep.
And I think that that would put the pressure back on the department that they're gonna be responsible for, because they said we didn't need it.
That's a good point. I can do that.
Lou?
Actually, John, what's interesting here is that if we were an authority, we might have an ability to pledge assets. We don't have assets that you can pledge to support an ISF that can be converted to cash. And frankly, as I said before, I think this is Renwick's positioning the department to speak to the speaker and tell the speaker, regardless of what conversations we're having with our representatives, that we don't need $7 million for an ISF because we don't need an ISF. You know, it's very clear. Some years ago, when Don Hapkirk had your job and Mike Head had Linda Zeller's job, Mike Head started a very active program for ISFs to be developed to the level of which they are required by the 12.5% of that budgetary requirement. I had a conversation with Mike Head and said to Mike, actually, you're doing that because you're concerned that authorities might not be able to support shortfalls, so you're insisting that the ISFs be built up across the board in order to protect the department against that kind of situation. And I said, Macomb County is a county department head situation. We don't need an ISF because we have the goodwill of the county in the support of our program. So you can forget our ISF and we'll put that money into consumer services. And Mike said, nice try. And here we are all the way around where Renwick is picking up on that same attitude, but for a different motive. And his motive is, regardless of how hard we brief our reps with the correct data, he's going to go to the speaker and say to the speaker, they don't need an ISF, and that's going to seriously affect how our reps can be effective because he controls the budget situation for the House. And he controls how items come up for consideration and how budget adjustments can be made. And if he gets to the speaker with this situation that says we don't need an ISF, that's putting a torpedo right into the side of our program. So I think that Brian's comment is really on the money, where we should tomorrow communicate with Mr. Renwick and indicate that we have discussed with the board the particular meeting, and we would appreciate in writing his position that we no longer need an ISF because we're concerned that future audits may give us a problem when the rest of the State Department isn't aware of his position for the State Department. I think we ought to put him on the spot. And I think if we don't do that, you can forget the $7 million, because as hard as our people will work, the speaker will react to Renwick's input and indicate they don't need the ISF. So let's ask Tom to put that in writing and to ask him for how long the necessity of not having an ISF is in effect. Because if it's forever, then we can shift a lot of money here very quickly. And frankly, based on that in writing situation, that might be how we deal with it, because if he wants to put in writing what contradicts standing state law, he's an attorney, as I recall his credentials, and that will show me a lot of chutzpah, because I think, frankly, what he's saying to you, he may not care to put in writing, and I think we need to do that. So that's my recommendation.
Okay, I will make sure I follow up and send him a letter tomorrow, or if not, Monday soon, and get clarification on that, or at least his position in writing.
Make sure it's for how long we don't need an ISF is in effect, because I think that's the critical part. If it's in effect till December, it's nothing. If it's in effect, we want to know forever, because frankly, there's about $5 million we could shift right off the bat, John, and I think if you'll put that in writing, then that's great. Because he's heading to the speaker. When our reps approach the speaker will pick up the phone and talk to Renwick or Linda Zeller, and if they say they don't need the ISF, the speaker is not going to respond to our reps' efforts. It's going to, they'll be spinning their wheels and not able to accomplish it, because that, I think, is what the strategy is, frankly. So we ought to counter it. I think Brian's comment is right on the money.
Okay. Well, Cindy, did I miss anything on that?
No, other than that we did get clarification regarding the use
Oh.
of the combining of the Healthy Michigan and the Medicaid on at ISF. I know that that's been a concern.
Cindy, come on up.
I know. We just did get some clarification. I know there's been the concern as far as the accounting of the Healthy Michigan and the Medicaid and combining that as far as the ISF. And we sat there and we did ask them point blank, and they confirmed that they had confirmation from CMS that we could do that.
Yeah, but it's nonsense. You can't, if you are challenged where your ISF comes into play, you can't touch the Healthy Michigan money that was shifted over, Cindy. You can't do it unless you're willing to spend 5 years at Leavenworth. It's that simple. You can't spend that money on Medicaid expenses as an ISF. So putting it in to show a balance, and I don't quote Republican presidents, but that's voodoo economics at its height. It really is. That's nonsense of putting that $6 million into your ISF when the law won't let you spend it. It's if you want to put up a phony report to the legislature about positive situations of PIHPs or whatever reason motivates you, the reality is if the ISF comes into play, you can't touch that $6 million at all. So, saying it's okay to do it.
Lou, she's the messenger, Lou. We know how you feel about it. I've heard voodoo economics out of your mouth more in the last month than I've heard in the last 6 years. I know, exactly. Kathy, you're next on the hit parade. Thank you, Cindy.
Thank you. I want to go back to what you talked about, a tool? What's that about? For CLS?
Yeah. I think at some point in time, I believe one of the providers, my suspicion is one of the providers, I'll leave it at that, probably contacted the department and said that we were inappropriately using a tool to, maybe a tool would be you can get between 3 and 6 hours of CLS. All right, simplification. To determine necessity for CLS, whereas where we do practice, we use medical necessity. We look at the person-centered plan. We look at the medical necessity. We look at locus scores. We look at CAFA scores, I believe. We look at, different scores that determine one's complexity and need, as well as, what the family needs to be able to support the CLS. But it was portrayed to them that we were using a tool of which Jim, I took leadership, I believe, and sent a litany of information to them and saying, "No, we're not using a tool. Here's what we're doing. Is what our practices are." Some of our practices, I believe now, are even modeling CMH of Central Michigan, who has a pretty well-defined practice on how they authorize CLS services. And so, meanwhile, in my email, I attempted to contact my contract manager, our contract manager at the department, repeatedly, and I was like on extinction. You know, they just weren't getting back with me. So finally, I just kind of aired my beef a little bit with Renwick, saying it's been 3.5 months and I haven't heard nothing yet. So, as you read my email, which I sent to everybody, I remain convicted that we're not using the tool, and until the department, takes a ruling on it and sends something different to us, then we just remain steadfast in how we are practicing CLS utilization.
So we're using Central Michigan's tool.
We're using Central Michigan's practices, methodology.
I get
level
that,
of
but
care. It's a
I
level
guess I don't understand what's meant by a tool. I mean, if it's a you're using something to.
Well, that was the way the email was sent to me, just a tool. And so, we use level of care guidelines and a number of other measures to determine whether or not we're going to, person-centered planning foremost, on whether or not we're going to authorize CLS services.
So what I like to understand, what we're being accused of inappropriately assessing how to assign CLS hours?
Correct.
I mean, because all the things you said to me are a tool. You look at all this various data and all these various scores and whatever. Okay.
I think the implication is that, we're looking at a sheet of paper and saying it doesn't matter if you're Linda Bush or you're Kathy Vosberg, we're going to give you the same amount of service. Based on what our tool says, based on what, Kathy and Linda need individually.
Yeah. All right.
So if I can just wrap up then, unless there's another question. Was there another? I'm sorry.
Yep, we have a couple more questions. Susan and then Linda.
So I try to be brief. Yeah, I mean, a tool I would envision that wouldn't be permissible would be like a across the board 10% cut. That's not appropriate, right? So that's kind of what I think of the distinction. But I agree with Commissioner Vosberg. So I like this suggestion that we get it in writing and that we get for how long, because is it just till the end of their appointed positions too? Because could a new director come in and have a different opinion on whether we need to have that money? I would also like it in writing what Cindy said about, they said that they've got confirmation from CMS that it's okay for us to use the dollars and shift them over. I'd like a copy of whatever opinion they got from that, because I'm not sure they really have that.
It's in our contract.
That we can shift the money?
That was the amendment number 2 to the contract last year, if I'm not mistaken. And the board already seen that and approved that, yep.
That we moved the money over, or that we allocated it. But I thought the discussion was that the department had said that they had gotten confirmation from CMS that we could spend those dollars there?
No.
Okay. So
if I can comment to that, the department, and what's on the table, the department in there, I believe it was the amendment number 2 to the PIHP contract last year, and the 17 contract carries forward in the 2018 contract. I'll find the language for it and give it to you. You have the contracts. They're in the mailbox, but there's language in there that says it's permissible for your strategy to commingle, we'll use that word, my word, commingle Medicaid and Healthy Michigan Plan funds to substantiate a strategy. However, it's not going to be permissible if you have an overrun on your Medicaid side to use your Healthy Michigan to bail yourself out. It's only permissible for the strategy. And that's a challenge I think the department is having with CMS on how, when Healthy Michigan came into play, how it is that they're able to, run their finances. It's well beyond me on that. But our current contract that we signed has that language in there.
Signed with the department.
Yep, our PHP contract with the department has that language in it.
Okay, so my question is the department said that they got confirmation from CMS that we could put it as a placeholder.
Mm-hmm.
And and even though it's written in our contract between us and the department, my question is where does the department have that permission from CMS? That's my question.
Yeah, I understand.
Okay. So I understand that it might be in our contract that we have with the department, right? The state mental health department, correct? But not with CMS? Let me ask the chair. So am I misstating something?
Well, I don't believe I can ask the department if they can give me the language that they received from CMS to help us further understand the situation.
Yeah,
can do that.
that's what I'm looking
Okay.
for, because
I'll do that too.
I'm not quite sure that
I'll do that
I
too.
agree with that. But
Okay.
then my next question is if the state is saying that we don't need to have this reserve fund, do we know what our peers are doing? So we have comparables. Are they keeping this reserve fund that supposedly we don't have to keep? And what does the association say about this reserve fund? I'd like their opinion on it too.
Okay.
So that we can share this with the state reps so that they're better equipped. I mean, I'm even if we are allowed to not have this reserve fund, I'm not sure that that's economically prudent, and I'm not sure that the county would agree that they're going to be holding the bag should we fall short. So that was my next question is, we don't have any assets to pledge to this. Does the county have any assets that they're going to pledge to this? My guess is no.
It depends how far the overrun is.
Yeah.
Because, that's not true neither. Through our strategy we would be responsible. So you're right, the county would be responsible for the first 7.5%. And then after that, the department would be responsible for everything over and above. So.
Okay. And so the 7.5%, we have to make sure that we would have the county's agreement through the executive office and the board of commissioners that that's acceptable to them and how they would fund that should it come to fruition, whether they would have the cash or bond for or whatever they would do. And then I'm sure that from there it would go to, corp counsel or risk management to decide how they're going to manage that. I mean, I don't know that we could just adopt this strategy, I think is what I'm hearing everybody saying, even if it's the state says it so. I'm just, having been a former commissioner, I don't think I would rest well with that,
So it's not to your question. I understand where you're at with that, but our ISF is going to go out on December 8th. I'm sending an ISF on December 8th. That's the deadline. Okay. So we are going to, hopefully we'd be able to, at least I'll be able to see and have an understanding of the interim FSR that's delivered in November. The one that spooks me is the February one. We won't know how we completely closed out of last year, September 30th, until February. And that's when we had some really serious swings because there's no more Medicaid revenue coming in, but all of your debt's still coming in. And so what happened last year, all of a sudden all of our Medicaid dollars started tanking because our debt was coming in until we closed our books. So that's the interim one that you'll see next month doesn't spook me. The February one spooks me based on what happened in the last couple of years, at least last year. But back to the financial risk management strategy, that's deliverable and due to the department on December 8th. And I will write that using the $5 million that we have. I'll write that using the $6.3 million permissible according to the contract, and any other mitigation strategy that I can come up with to control acute psychiatric inpatient costs, to control for administrative costs, and any other services that were trending higher, and where we would need to practice utilization of management of those costs as well too. And if I don't, I think it's one of those recoverable things. There's a number of items, and I don't know a list of them all right now, but I believe there's about 7, 8 different deliverables that you miss the date and then they recover. There's a quality withhold or a withhold that they have in our contract, so they withhold our dollars. And if we miss the performance measurement on delivering, they're going to hold back, $75,000 for missing the date on when you deliver that product. So we have to deliver the financial risk management strategy by December 8th.
All right, Linda, and then Brian.
John, at some point you had said that Renwick said that, well, the 7.5 has really only been a maximum. And I recall it being addressed to this board as a maximum when we had a lot of money at the end of the year, and rather than give it back, you had to hurry up and spend it. But I don't ever recall anyone saying that there was no minimum. So instead of just asking him, because Lou's quoting Mike Head, who's been gone for a long time, and why he did what he did, instead of just having Renwick give it to you in writing, you went there and with your finger you showed him where it says in the PIHP that we have to mitigate it and that we can't as a county. I would ask him to reference his source. Where is he reading that it's a minimum? We've never heard that before. While we're on this, to ask if you're going to ask the legislature for some money, the 7.5 is confusing to me now with all these other figures. We've always asked for the other part of the 12.5, but it does, from what you just said tonight, doesn't appear we still need 7.5, which is confusing figure, 7.5 million to reach a 7.5 ISF. That it's something less than 7.5 million. So if it's confusing to me, it's going to be confusing to them maybe if it's not the exact amount. And then the other thing is, did he tell you anything about a determination from TBD, the study they were doing?
I think I did mention that, maybe I mentioned it too briefly, that he suspects that TBD will have that report done here in November.
Okay.
So I think that's why they called the meeting with Cindy and I again in November to review the budget. And, as you recall, the Macomb House delegation is wanting the department to give us technical advisory along the way, and I think he wants to show evidence of doing that, but it seems like it's myself that's putting my hand up saying, hey, can we meet, that type of thing. To your first question, I have to be clear with this, and I'll show you again in the interim report next month, and as I showed you in the third quarter report, we're showing a balanced budget this year, and we're also showing around an $800,000 savings. Well, that's not a lot, and I suspect by the time we get to the final report that could very well go away, but I don't know how we defend ourselves given our current financial department. When we went to the department and had that meeting up in Lansing with the House delegates, we put the paper in front of them that showed us that we were $9.8 million below zero. The report that I would put in front of them today shows us with a balanced budget this year plus an $800,000 savings. So it's difficult to, and I don't think it'll be that when we get to February, but it's difficult to say where is it you need the money when you're actually projecting the savings from 11 months from now. So, and it spooks me again too. I probably shouldn't be sitting up here and using that word too often, but it's one that keeps me awake at night and doesn't let me go to sleep too. It's like you don't want to miss this. You don't want to miss it in October because the legislature said they'd give you one-time funding, and they gave us $5 million, and we better be damn good at what we're doing on the administrative side to contain our costs, purchase what is necessary for our consumers, and deliver what is necessary for our consumers. And anything else that is nicety that isn't really required by the contract, we need to be cautious about and continue to be, financially mindful that it's still a tight budget. And what we don't know is rising enrollment. If enrollment goes up, we're good. I think enrollment is going up. If enrollment goes down, that's not good. We also know, as you've heard before, that the DAB, the disabled, aged, and blind, who are being converted over to TANF, the temporary assistance for needy families. You heard Bob Sheehan talk about it at the Metro Region dinner meeting. You heard him talk about it at the Metro Region breakfast meeting up in Traverse City. We're losing millions of dollars, and my staff will tell me sometime what we're losing. We're still trying to figure it out. The DAB, the disabled, aged, and blind, when they re-enroll in their Medicaid, CHAMPS is automatically re-enrolling them in the TANF. And so it takes 10 months to get on, to become a DAB consumer. And when you get a DAB enrollment, that's $250 per member per month. You're talking thousands of people, $250 per member per month. If they lose their DAB eligibility, because it takes 10 months to get into DAB, it takes 1 day to get into Healthy Michigan Plan. And Healthy Michigan Plan pays us, I think, $18 per member per month. We're losing millions of dollars on the HAB or the DAB gone TANF gone Healthy Michigan Plan. And so that's another thing that we're looking at here from a financial situation that's an unknown to us. We also received $5.3 million, if I'm not mistaken, in pass-through for the direct care wage increase for 50 cents an hour. So we're going through this exhausting effort to be able to query all of our providers by direct care worker name and the number of hours that they work and what their direct care wage was on September 30th and what their direct care wage is expected to be on October 1st, and we have to pass those $5.3 million back out to the network. And so you have a lot of variables, tangibles, intangibles, increased enrollment, rising acute psychiatric inpatient costs, many of these types of things that keep you a little bit unnerved when you start looking at the size of the budget. We spend a lot of time here, and I don't mean this to be a criticism, but we spend a lot of time as a group here talking about property management. Property management and the leases is 3.5% of our budget. 3.5% of our budget is property management. And the rest of all that budget, the other 96%, is not property management. And I think we need to, pay attention and have, difficult conversations to, what are we going to do about and how are we going to bring to the attention of the legislature, because the department knows about it, the DAB gone Healthy Michigan Plan. That's my term, DAB gone, that type of thing. I think we should spend more time talking about the intricacies of financing, even though that's not what we're about. And then also, too, the services that we're delivering. And I think it's been suggested to me more than once here to have people maybe take the podium and give you an overview of what the child parent psychotherapy initiative that we're getting into is all about, or take over and provide an update on what infant mental health services or our children's services are doing. Some of our direction that we're going. Jim is leading a group on strategic planning relative to systemic reform, system reform. Why is it so important that we have to be NCQA accredited? What is the home and community-based services waiver really all about? All of that's coming at us like a freight train. And I think that it would be, and I'll hopefully be more mindful to bring those issues to you as the board, but also, suggest that's where our head needs to be. We need to be looking at the money. We need to be looking at our population, our services. We do a lot. We do a lot of good services, and I've been on the phone. I was telling Lou, I've been on the phone with Ross Jones for the last 3 days, trying to get him to focus on what we do have in the way of opportunities and what we're doing relative to services. And I think we need to promote that more. When I offered up my strategic plan, I think I also indicated we need to be prideful and boastful about what we do. But this board, as you're challenged and responsible for, needs to deal with the difficult issues as well, too. But I think it'd be helpful to hear the good stuff, too.
Brian?
I have 2 questions. Just what you spoke about, the $7 million. I asked a few board meetings before if we could put a strategy plan together to show what services have been cut, and that's the reason why we need that $7 million. Not that we have a balanced budget this year, but these are the services that have been hit for this year, And this is why we're asking for that $7 million to start reinstating some of these services and to show the legislators how it is actually hurting their constituents that live in their districts. Then secondly, I like to put on the agenda for the full board if there's enough time, because I looked at it's going to be the 22nd. You said you got to be turned in by December 8th, or if we have a special meeting, I would like to have a discussion that we as a board would write the letter to the department and asking them to put this stuff in writing that they're telling you that's in there. And I don't know if you think that's a good way of doing that, to take some of it, to show that you're getting pressure from the board to get this properly done.
I second that. You guys can do it.
Well, I mean, through the chair. I mean, I'm just asking, because I like to put on, we need to have a discussion on it, because all honesty, I truly feel, like Lou stated, I don't think they're going to put it in writing. And that's just going to certify anything we've said, and we can tell the legislators, here's the letter we sent. They won't respond to the letter, so there's something wrong that they won't put it in writing. They're so confident to say it verbally and tell you verbally and tell anybody else verbally, but they're not putting it in writing. There's something wrong with it.
Well, I'll go in any direction you want to do it. If you want to have a special meeting for the content of the language, I'll defer to the chair.
I'm asking because of the timeline.
I'll defer to the chair on that too. I think it's administrative responsibility to come up with the language to the extent that my signature and the chair's signatures on it, I think suffices. You want to send a message and have everybody sign it? No, that's fine too.
Whatever the board would like to do. I just think that because of the timeline and everything else, is the 22nd enough timeline to get it to them? I don't have any confidence that they're going to respond back to us by the timeline for the when we have to deliver the strategy. So then secondary it is, the sooner that we draft a letter, gives them more timeline that they should have responded, and we can have the discussion with the legislators. Say, look, they got it 4 weeks ago and still have not responded to the question.
Well, I think they're two different. I see where you're going, but I think in my mind, they're two different items. One is you create the strategy and you do that according to the performance in the contract, and then secondarily that you also say, give us some relief in light of the strategy that we don't have to have an ISF. But I don't think you're going to. I don't think that I don't know if I said that right, but I don't believe the department is going to give us clarification prior to us writing an ISF. But perhaps.
Well, but like I said, the sooner you get it, this is the other aspect, the backup, because it rely on the county, and we could give it to the chair of the county commissioners. We'd also send it over to Mark Hackle and say, here's what we've done. They won't clarify and put it in writing. They also might have the county executor send them a letter and says, hey, you got to put this in writing. I think that's where the best pressure point we have at this time is to do that. And I mean, you guys give a discussion if you think that we needed to have a special meeting to do that, Chair. I mean, I'm open to anything on that. I'm just thinking the timeline.
Kathy?
I'm waiting to speak. Two things. First of all, I don't think this board needs to sit and write a letter. That would take way too long. I think it can be done by administration, and we can sign. If everyone wants to sign it, we can decide to do that or not. But I think it'd be better if the whole board didn't. Just as a time thing, we can, the director and the board chair can sign it and send it off. Speaking on behalf of the board and stuff. The other thing is, I thought I heard you say we need that $7 million so we can reinstate services. It's my impression that we need the $7 million so that we can be in compliance with the ISF requirements as they were understood before the discussion we had for tonight. So I don't know that if we got any more money, we would be able to reinstate any services.
And that could be true, but the actual thing is, when John mentioned I can't go back and tell him because we got a balanced budget, that we're asking for money. But if we showed that we're taking these hits, and it may end up going to the IFF or where it needs to go on that aspect, but when we get that $7 million, we put the pressure on the legislators on the fact that these are your constituents, this is what they lost. They're going to put in their back of their mind, You know, this is something we really need to, I mean, if I was a legislator, I'd be looking at that. If I gotta go face the community and say, here, this is why the state did this, and we had a chance to fix this, we had the information, and we show what services have been cut, because we have been cut a great deal. And since we have a balanced budget this year, and you know, and it could be you got a balanced budget. But also, here's what it costs to get the balanced budget. And that's why, and they verbally said, I've heard through a lot of verbal contact, that they were going to give us the $7 million this year.
Okay, but again, I'm not sure what else to say, except that the 7 million is to make us in compliance with the ISF. And I would never want to say we need it because we cut all these services and lead them to believe we'd be able to reinstate services, and we never do. That would be worse yet. To take the money, to say we need it for a reason for which we have no intent on using it.
Well, I mean, we can word it to the word, I mean, in the wording of it, here's what we've cut. $7 million is going to put us in a situation we can look at to try to put some programs back together, or can reinstate some of this stuff in there. I mean, it's money. They said they were going to give it to us, and now we have to fight to get it, even though we have a balanced budget.
All right, well, I think we're talking about two different things, but if you want to talk offline to me about it, I just don't quite understand, or talk to John about.
I never said I could speak good.
Right.
Good.
All right, very good. But you have the passion, and that's coming through loud and clear, so thank you.
If I can just have a comment, a concluding comment, maybe, I think I mentioned to introduce Pat Jens last time. Did I do that, Pat? Pat Jens has been with us for a long time. She knows as much about community mental health and what's going on in Macomb County and the state as anybody, and Pat's been an integral resource for us off and on since her retirement, and she's back on again, so I'm pleased to have her with me and with us, supporting us. She's a great wealth of knowledge, and Pat and I will craft a letter and get you guys a draft here real quick.
Thank you, John. Nick?
Yeah, I was just going to say the thought of this board writing the letter gave me a headache just thinking about it. I'm very comfortable with the director and the chair composing the letter, and Pat can help you. That's great. I do think you have to separate the issues, Brian, between services and the IFS and all that good stuff. So keep this one simple. But one of the things I think everybody ought to understand is that there's about a 99% chance that you're not going to get a response to that letter. And so I would urge you to copy it to the speaker so that, when they don't answer the letter, the speaker knows that they didn't answer the letter. And I just think that's kind of important. The department is dancing a lot right now. The subcommittee chair, who happens to be from Oakland County, and Oakland County also got cut, told me to my face that the department told him that the reasons for the cuts to Macomb and Oakland was that the federal government required them to do that. Now, all of us know that the study was done at the direction of the state, and it just doesn't work that way. The recommendation goes from the state to the federal government, not the other way around, and then they approve or disapprove. They're just basically trying to get him off their back. I do think this time around we should try to coordinate a little more closely on money asks with Oakland County, because we essentially started this thing believing that Macomb was the only one being cut, and it turned out that it was both Macomb and Oakland, and there are some good things we can do if we coordinate some of our asks with them for the next budget.
Yeah, I agree with where you're at. I don't believe you're going to get a letter back from the department anytime soon. And I think that, as I used the term before, I think we're in a canoe by ourselves when we got cut. There were, Oakland was cut 2%. Nobody was cut 17%. Yeah.
They're conscious of the 2% cut. So there's ways to use that. I just think this time around, we should utilize that, particularly since the chairman of the Senate subcommittee of the Appropriation Committee that deals with this budget lives in Oakland County.
Lou?
I just want to be clear, Mr. Chairman, that anything less than a full funded ISF is dangerous and not prudent. In the case where the ISF dollars have to be utilized and you don't have them, you have exposed the CMH and the PIHP's liability, which transfers immediately to the county. So if we accept Renwick's, you don't need an ISF, we're playing with fire with Macomb County. That's number one. And in the event that in the next fiscal year that we have to apply ISF funds that we don't have, the county's liability comes into play before the State Department or the state's participation comes into play. So our pursuit of the $7 million that was promised to us in the next budget is extremely important, because that would fund the ISF at $12 million plus. And that in itself would provide security for our going forward with programs and attempting to balance a budget and to provide services, because we would reduce the pressure of not having a fully funded ISF. So we do need to follow up on that promise from the Speaker in the next budget for consideration of that follow-up $7 million, because it relieves the pressure. And if we don't do that, the Board of Commissioners and the county executive would be perfectly within their right to wonder just what's going on if we didn't inform them as to what was happening on a continuing basis with the state situation and the ISF problem. So I just want to be clear, that there's nothing that says we should not pursue that $12.5 million goal, because if we do that, it relieves the pressure off so much else. I just didn't know if that was understood, so.
Thank you, Lou. I don't see any other speakers for other agenda items. I have a couple items real quick. Just for everybody's knowledge, tomorrow is the last day that the Board of Commissioners is meeting for 2 weeks. Tomorrow is also the last day the state representatives are meeting for 2 weeks. So just a heads up on their timeline. And then after Thanksgiving break, the House is in for maximum of 3 weeks before another 2 weeks for Christmas break. So just so you're aware of the timeline up there. Our next meeting is a full board meeting on Tuesday, November 21st, not Wednesday, November 22nd. Don't forget. I'd also like a motion to excuse Joan, Christopher, Marilyn, and Selena for tonight. I got a motion from Linda to excuse absent members. I'm doing it just in case. Support from Kathy. All in favor signify by saying aye. All opposed? All right, next is hearing of the public. Anybody from the... Sorry.
Mr. Chair, I did put in a request to...
Go ahead, Kathy.
Just to, at that November 22 meeting, an item on the agenda will be, we have to decide what to do with the recordings of these meetings. The Board of Commissioners and other committees that meet using this technology do post the meetings in an easy format for the public to access. So we need to decide that. That'll be on the agenda, so something to be thinking about for something to be thinking about between now and the next meeting. Where and how do we want to put these recordings of our meetings? Do we want them on a website, or do we just want them put in storage somewhere for people to access should they FOIA them? Just be thinking about that, and we'll have some options available it'll be on the agenda for full board.
Just as a follow-up tidbit to that, the Board of Commissioners, we have our meetings posted on YouTube so they can be searched, or they're also on the Board of Commissioners website, and you can search by agenda item so you don't have to go through the whole meeting. It'll direct you right to that item if you're interested in that and don't want to listen to 2 hours of our meetings. So any other agenda items before I move on? I don't see anybody. Okay, next is hearing of the public. Anybody from the public wishing to address this body of 5 minutes? Going once, going twice, seeing none. All right. With that, we're adjourned.